Juneteenth as a federal and now a state holiday. And joining us today to talk about the importance of this day and what it means in terms of health care is Vice President of Health Equity at Hartford Healthcare, Sarah Lewis. Hi, Sarah. Thank you for being here today.
Hi, thanks for having me.
All right, let's first remind folks exactly what is Juneteenth and what does this day symbolize?
So it's helpful to think of Juneteenth as America's second Independence Day. So we're familiar with the first one, when the Declaration of Independence was signed and we declared our independence from England in 1776. 89 years later, Union troops finally arrive in the western part of Texas and announce to enslaved people there that the Civil War is over and that those people are free. This was 2 years after the end of the Civil War, and so it took that long for all people in this country to actually be free. So it's the moment when we can recognize that African Americans were free as well.
Why is it so important that healthcare professionals understand that history?
So because of that legacy of people not having freedom and not having equal access to things like education and housing and healthcare, our healthcare system was not fully desegregated until the middle of the 20th century. Those things actually at a population level have an impact on people's health at the individual level. And so as healthcare providers, we have to be aware of that there may be those upstream influences that lead to people having certain chronic diseases and issues that put them at greater risk of having a low health status.
And
at the same
I'm sorry, go ahead.
Sorry, go ahead. And I was going to say, at the same time, as healthcare providers, we advocate on behalf of our patients. And, it takes time for freedom and justice and things to take place, right? I said 89 years after the Declaration of Independence was signed. So we just have to keep fighting the good fight to keep guns out of our schools and to prevent danger from happening to our patients, fighting for access to reproductive rights for our patients, things that we know are good. It just takes time. We have to keep our heads keep our shoulders to the wheel and keep going.
Also, Hartford Healthcare does have some plans to honor this day, right?
We do, absolutely, and we've actually already honored it in the Fairfield County region. Our Juneteenth parade there was grand marshaled by Camilla Lawrence, an incredible doctor in our Cancer Institute, and we're also part of celebrations here in the Hartford region through the Amistad Center for Arts and Culture, and throughout our organization, recognizing Juneteenth as an important day for all of us as members of this community.
All right, and Sarah, I know that your focus and your organization are focused on health equity. What are some of the goals you have for us briefly?
Yes. Oh, thank you so much for asking that. We're looking at an opportunity for all of our patients, regardless of their backgrounds, to have the opportunity to be as healthy as possible. So that means understanding everybody's hypertension level, their diabetes level, making sure we're screening people for all of the chronic diseases and preventable cancers that we possibly can, and meeting people where they are, so that over time we see those numbers level out and that nobody is disadvantaged in their health because of who they are.
All right. Sarah Lewis, Vice President of Health Equity at Hartford Healthcare. Appreciate your time. Thanks for being here today.
Thanks for having me.